This case is a patient on the cardiac OR. The patient has atrial fibrillation and will undergo a MACE operation. A MACE operation is a thoracoscopic video-assisted pulmonary vein isolation followed by left and right atrial appendix resection. Okay, John, we are just waiting for the surgeon. Are you fine?
Yeah, I'm fine.
Okay.
Good morning, all.
Good morning, Tom. How are you?
I'm doing very well. How are you?
I'm fine, thanks.
John, good morning.
Hey, morning.
How was your night's sleep?
It was all right.
All ready for the procedure?
Yes, I am.
Before we're going to start, we'll do some safety checks. First, I'll introduce the team to you. We already know each other. My name is Tom. I'm going to be your surgeon today.
Lotte, scrub nurse.
I'm Benedict. I'm your anesthesiologist.
My name is Albert. I'm the anesthesia nurse.
Perfect. And you're the most important person today. Can you tell us your name and date of birth?
John Doe, born on January 1st, 1975.
Yes, I have the same over here.
Same on this side.
And I have the same over here.
Perfect. Can you tell us in your own words what we're going to do today?
Thoracoscopic pulmonary vein isolation.
Perfect. Perfect. So we're going to do both sides. So marking of the side is not applicable today. I don't estimate any problems surgically from our side. Do you have any?
No problems to be expected from our side.
Perfect. I'd like 2 grams of Kefsol for antibiotics, and positioning will be supine with arms extended.
Okay.
Do you have any allergies?
No allergies.
Perfect. Did you use your anticoagulation?
I did until 3 days ago.
Until 3 days ago. Perfect. How is blood status? Do we have blood readily available?
We call it the blood bank. The blood is available there, so we don't have it on the OR, but we can have it if we need it.
Perfect. I don't think we'll need it, but if it's available,
yeah,
that's perfect. I'm going to need everything for a video-assisted pulmonary vein isolation. Do you have everything for your end of the procedure?
Yes, we will place a double limit tube to facilitate lung isolation, and we'll put in a TAE probe to check for thrombi in the left atrial and right atrial appendix.
Perfect. Don't need a large bore central line to large IVs will suffice.
Okay. Can you tell us, did you eat or drink something today?
No, I had supper last night, 8 o'clock, and I had a glass of water this morning.
Okay, that's perfect.
Perfect.
Can you open the mouse, please, to check the airway? Okay, I don't expect any problems with that.
All right, I'll get ready. I'll go scrub.
Okay.
And they're going to take good care of you.
Yeah?
Good.
Okay. Okay, John, we will start. You first get a mask with some oxygen. You can just breathe slowly through it, and we will start with some medication. Albert, I already double-checked the medication. Everything is fine, everything is valid. And I would like to start for pre-induction with some sufentanil.
All right. I have here.
Sufentanil 5 microgram per milliliter. Just start with 25 micrograms. That's 5 cc.
I will start with 25 micrograms sufentanil, 5 cc's.
I'll document 25 of sufentanil.
So that's 5.
Okay. Yes, thank you. You can feel a little bit drowsy in a couple of minutes. And can you give him some lidocaine to prevent pain for the propofol injection? 50 milligram, this lidocaine 1%, that's again 5 cc of this solution.
Okay, I will give 5 cc's of lidocaine 1%, 15 milligrams.
15 milligrams of lidocaine.
So 5 cc's.
Yes, 5 cc. You feel already a little bit drowsy? Yeah? Okay, then we go ahead, and I have an entitled CO2 of entitled oxygen saturation of 90%, and we'll go ahead with propofol, and you will fall asleep. Just give 150 milligrams propofol. This is propofol 10 milligram per milliliter, just 15 cc.
I'll give 15 cc's of propofol, 10 milligrams per milliliter.
Propofol, 150 milligrams.
Sleep tight, John. We'll take good care of you.
Have a good sleep. Okay, that's great. Close your eyes. Yes, 15 milliliters is 150 milligram. I will just help you a little bit. Breathing. Okay, that goes fine. So we can go ahead with a rocuronium. This is rocuronium 10 milligrams per milliliters. We will go ahead with 60 milligram, that's 6 cc.
I'll give 6 cc's of rocuronium, 10 milligrams per milliliter.
And I can ventilate him well.
60 milligrams of rocuronium. I'll
Yes.
start a timer.
Okay, perfect. The course of the operation was further uneventful. At the end of the operation, suddenly a severe bleeding occurred when the surgeon resected the left atrial appendix.
All right, I have good exposure. Benedict, I just ruptured the left atrial appendage. I have a massive bleed over here.
Okay, I also have low blood pressure. Can you stop the bleeding?
I'm gonna try and
Can you try that?
fix it thoracoscopically.
I will increase oxygen.
Now we'll definitely not manage
I
it
still
like
have
this.
a low blood pressure.
Yeah.
Albert,
Can
could
you
you
call
press the emergency button to have
Yes.
more hands on?
I'm
Benedict,
pressing the
can you
emergency
call
button.
perfusion? I think we'll have to go on bypass.
Yes, we will prepare for that. So
And I'll need
try to go ahead to stop it there. We will need some minutes.
Yes. Can you also call a second OR nurse with
Yes,
the
we will
sternotomy
do.
tray?
Peter Magnus, we have a 50-year-old patient undergoing a MACE operation. Tom is nearly at the end of the operation, but now he has a rupture of the left atrial appendage. So we have a massive bleeding. He's trying to stop it thoracoscopically, but we think that we have to go for thoracotomy and to have to go on pump. So we will prepare for that.
Okay. Shall I read from the emergency manual?
Yes, please. The
let's
massive
see.
bleeding protocol. We already called the blood bank.
Okay. Stop the bleeding. We're working on that. Trendenberg position.
Yes, we will do that. Go ahead, go ahead.
Large IV access.
Yeah, I have two peripheral lines. Peter, could you please place a central venous line, a large bore central venous line, if you go on pump?
Yeah. Tranexamic acid, 1 gram.
That's a good idea. So can we have tranexamic acid?
Yes. Here you go.
Here we go.
Can you also start with heparin?
The tranexamic acid is in the patient.
I have heparin, 25,000.
25,000 heparin is correct for this body weight. The heparin is in.
Heparin is in, thank you.
Start the clock. And
Permissive hypotension.
yes, we just have blood pressure of 60, so that's fine. So we're preparing everything.